So for the first talk in the program, I'm going to call on Dr. Sunita right? CHAURASIA. And we're going to hear about Rhokinase inhibitors.
Thank you, Yeah. So Rhokinase inhibitors, and these are for basic researchers as well as clinicians, can be one type of enigmatic molecule. So my talk is on Rhokinase inhibitors. Are we close to clinical application? Now, when we talk about Rhokinase, it is important to know that ROCK pathways are existing in the corneal endothelium, and these are the pathways which control several of the cellular functions. The activation of ROCK pathway in corneal endothelial cells is paramount in the pathogenesis of corneal endothelial dysfunction. ROCK inhibitors, when we use, they target the ROCK pathways by inhibiting the enzymatic activity of the two ROCK isoforms, ROCK1 and ROCK2, and hence their application in endothelial dystrophies, endothelial injury, and post-operative endothelial cell regeneration. If we look into the various kind of ROCK inhibitors, the chemical structure wise, there are 4 different types of ROCK inhibitors, the Y27632, which was the first initial molecule, and then fasudil, ripasudil, and nitasudil. Of these, the interest is in 2 molecules, which are ripasudil and nitasudil. So ripasudil is available as Glanatec 0.4% in Japan and Ripatec as 0.4% in India. Nitasudil as Ropressa in US and Netalo in India. So application-wise, if you look at the various studies which have used these Rhokinase inhibitors in Fuchs endothelial dystrophy, there are majorly about the clinical study with good sample size, good number of patients, 3 or 4, majority are with very small sample size of case reports and all. So there are 2 studies, I'll name it over here, and these are the ones which they have tested the ripasudil along with DSO in 2 studies with sample size of 23 patients and 18 patients. And nitasudil has been used per se as a standalone therapy in some cases in 1 study with good number sample size of 29 patients. In pseudophakic corneal edema, this was the landmark paper from Professor Kinoshita. It was used in 11 patients, and we had good results with that. So if you look into, summarize into the applications of Rhokinase inhibitors, what we have currently as evidence is as standalone therapy in endothelial diseases, there are very few, and is majorly used as conjunction with other therapies and procedures, mainly with DSO and with cultured endothelial cells. Evidences supporting efficacy, standalone-wise in Fuchs, there are few studies. One is by Price et al., which was testing nitasudil application in 29 patients. And then we had some patients where it was used in, this is just a case report, in IC syndrome, and special situations where it was used for cases which had a low cell density, and these was 4 patients in that study. Looking into the safety consideration ROCK inhibitors, the data has come from the glaucoma trials, and we know that 94% had adverse events, majority of which ranged from conjunctival hyperemia in majority, from blepharitis to allergic conjunctivitis, and eye irritation. Safety consideration for nitasudil has come from the Rocket 1, 2, 3, phase 3 clinical trials, again from glaucoma studies and Mercury trials. So where nitasudil was used once daily and compared with timolol, again the same spectrum of side effect profile was conjunctival hyperemia, cornea verticillata, and conjunctival hemorrhage. So overall, not very severe symptoms, but then conjunctival hyperemia remains a major side effect pertaining to Rhokinase inhibitors. I'll just share some of my personal experiences where I've used in some clinical situations, such as Fuchs endothelial corneal dystrophy, where there was evidence of subclinical edema and early morning symptoms. I have also used for pseudophakic corneal edema and cases where you have low cell density, like grafts with low endothelial cell density and requiring cataract surgery, post-graft rejection in the resolving phase, and I'll just put a perspective of what it does in the normal healthy eyes. So in FECD and pseudophakic corneal edema, there's a variable response which I've experienced. Some patients do have a response, some patients are equivocal, and some patients just don't tolerate the medication. So these are some of the representative cases. I'll share this one case. This was a patient who came in Jan 2022, and she was already using ripasudil twice per day. She was quite fine with that. And December 2022, she stopped using ripasudil altogether. And these are the OCT images and the specular images. The E and G are from the center part of the cornea of the right and the left eye respectively, and F and H are from the superior part of the cornea. You can see the endothelial morphology in F and H, but in the center part, as is well known with Fuchs, will not be able to capture the endothelial cells. So she was quite okay with that. And 1 month later, when she stopped the medication, this is how she landed up with. She came with obvious edema, increased symptoms, And she was not able to procure Ripasodil, and that is why she had stopped it. And we can see that the epithelial, the OCT shows the epithelial edema bullae in both the eyes. Subsequently, we did start her on, she procured the molecule, the medication, and this is how the edema resolved subsequently, and she has been on follow-up. And in her last visit in December 2024, she has been maintaining good vision, decent vision, and has been uh, living with this a routine of using Ripasodil twice per day and has been asymptomatic so far. This is another case who was a professor. His requirements was that he wanted to have some medical therapy in 2018. He came with symptoms of intermittent blurred vision and was using hypertonic saline. And that time, Ripasodil was not available in India. 2022 onwards, we started Ripasodil along with hypertonic saline on SOS basis, and he is stable till Jan 2025. So he's been asymptomatic and managing his routine well. So again, the same thing, the top picture shows a specular microscopy from the center part of the cornea, where we cannot procure the images, but the peripheral cornea shows a good amount of endothelial cells. This is one case of pseudophakic corneal edema with a sectoral nature. It is partly involving the center area. And as we see in the first picture, the image has been captured from the mid-peripheral location. In the subsequent, when the medication was started, this is how he has been. And the patient, the second image is a specular image from the center part of the cornea. And thereafter, the patient has been stable since 2020. Now, why 2020? Because this is a time point when this medication was available, and that was a time when there was no corneal tissue, and that is why we had to look for alternatives, and that is how most of these patients are from 2020 and 2021. This is another case, case 4, where we saw this patient in 2020 again, 8 years post-PK, and she was having a partially functioning graft. This patient is stable without worsening of symptoms till last visit in December last year. So she was again put on the same medication. As of now, she's okay. So this is another case, case 5, where PK was done for keratoconus, and the patient 6 months later landed up with a rejection episode. The duration was of 3 weeks duration, 3 to 4 weeks. IVMP was given. She had persistent edema with 6 weeks of treatment. Now, generally speaking, when we see a severe graft rejection with a 3 to 4 weeks symptoms and without any therapy, we will expect that graft to sort of fail. But this particular case resolved after there were 6 weeks of persistent edema. Subsequently, there's a good recovery seen in April 2022. And thereafter, in October 2023, this is how the picture is in the last visit, 2024 October. The last visit, she's doing well with a good maintained vision, 2040. We can always say that this was a case of keratoconus. Probably there was something to do with the redistribution of the endothelial cells, which could have accounted for a good recovery in this particular case. Now, this was one case, and again, this was one study which we undertook in normal, healthy volunteers during the same time period when 2021, where we wanted to look at the molecule was available in India. It had got the DCJ approval, and we wanted to see what it does to the normal endothelium in normal, healthy volunteers. So we did see that there's a pattern which gets altered. This is a normal morphology. And when you see the second image, there's a dark light reversal pattern, something similar to what you see with the eye syndrome, which subsequently gets altered to back to normal in 3 to 4 hours. Now, the implication of this is that if you have to image any patient, any person who is on Rhokinase inhibitors, we have to ensure that the specular microscopy is done 3 to 4 hours later. Otherwise, we'll get a fallacious count. So this is what we did, and this was kind of consistent in every patient, every 14 healthy volunteers, which we saw in that time period. To summarize the current status, we certainly see that there's a positive outcome in corneal endothelial diseases with Rhokinase inhibitors. However, there's a variability in responses. Some limitations remain, longer duration of effect compared to surgical management like DMEC. We don't know, there is a time point where we have a certain limitation because it may not be very active immediately compared to DMEC surgery. It may be ineffective in advanced stages of disease when endothelial cells are not healthy at all and when peripheral cells are not adequate. And this might lead to Ripasodil or Rhokinase-related corneal edema, which is well described as honeycomb edema. Long-term outcomes with larger sample size is required to really know what is the outcome, which at this point is missing. And we also don't know, we know that it works very well with DSO in FECD cases, but how effective it is when CEC layer is intact is not certain. And what is the optimal frequency of medication, again, is not very certain. So we do need further investigations on standalone therapy before standard guidelines can be established for its use. Thank you very much for your patient listening.
We have a moment for questions, and since we have Professor Kinoshita sitting on my right over there, I'm going to ask you
Yes.
to comment. Would
Well,
you?
thank you very much. And Sunita, that was very nice, I think, very nice presentation. Although we know some of the, if the endothelial defect and it's kind of an acute injury of the endothelial defect, at that time, Rhokinase inhibitor is effective. That is based upon the animal experiments and also human experiments. And now the DSO with some of the eye drops of the Rhokinase inhibitor, Ripasdil, that was, I think, a clinical trial, phase 2 was performed in the US, and that was successful also. So we understand that. But for instance, Fuchs endothelial dystrophy without any endothelial defect, whether the Rhokinase inhibitor is effective, you said that is still the kind of positive but questionable. So I think we really need some kind of a double-blind clinical study or something like that. But your data is quite suggestive. It's a positive. So I'm at least in my personal opinion, very happy to hear that. Thank you.